This is Focus
with Cassie McCullagh
on ABC Radio Sydney.
Hello, good to be with you on ABC Radio Sydney. I hope you had a great weekend. And a special welcome to our listeners joining us on ABC Radio Canberra. It's a public holiday in the ACT, so lovely to have you along. We're talking about our international borders in a moment and the difficulties of both getting into and getting out of this country right now and the heartache this is causing for so many. Maybe you're one of them. It's been 13 months since the federal government imposed restrictions on Australians leaving or entering the country due to COVID-19. Back in March last year, we'd have been dismayed, to say the least, to know where we are today, with second and third waves raging in different parts of the world, another state lockdown, WA dealing with another quarantine outbreak in a hotel, and a vaccine rollout with more questions than answers, and no big change for the foreseeable future on the way. Maybe you're like me and you're confused about how the whole system is working or not working around this. Is it time for a big rethink about how we are doing our international borders? Is it just unreasonable to continue stopping Australians from coming home and also leaving the country for important matters like seeing family and loved ones? Looking forward to your thoughts and contributions this morning. 1300 222 702. Do feel free to join the conversation. Yeah, incredible sight yesterday. Essendon facing Collingwood for the traditional Anzac Day clash at the MCG. Essendon won by 24 points, but that wasn't why the game made global headlines. The match was attended by 78,113 people, which, as you may have heard, is the biggest sporting crowd in the world since the beginning of this pandemic. Viewers from across the planet would have seen the vision with disbelief at the extraordinary display of freedom. But it has come at a price. In some estimates, there may be more than 78,113 people waiting to get back into Australia. Kate Jeffries is the co-founder of Stranded Aussies Action Network. She's based in Perth and she's with us this morning. Good morning, Kate.
Good morning, Cassie.
Yes, you're joining us from lockdown because, as we know, a returning traveller brought home the COVID-19 from India, it's believed.
Yes, that's right. I think for our situation in Perth here, it's really just highlighted what's come out in all of our inquiries, both the Halton inquiry and then the Victorian one with Jennifer Coate, where they highlighted that hotel quarantine was actually not fit for the purpose, and that other methods should be investigated, such as home quarantine that's assisted by technology. And unfortunately, that hasn't been followed through at the federal or state level, and here we are in lockdown again.
Yes, and there has been some anger, not at least expressed by Mark McGowan, your Premier, saying that we really have to look at why people would be leaving for something like a wedding, which is apparently what this person returned to India for. Others say that's just too harsh. You particularly have an interest in this. Tell us your story.
Well, we left Australia in February 2020 to go to Canada after we found out my mother-in-law was diagnosed with late-stage ovarian cancer. We left our home for 4 weeks to go and assist her getting set up with her chemotherapy and everything else. And the call was put out on March 17 by the Prime Minister to come home if you could. And we had our tickets booked home, and 3 days later, our tickets were cancelled. The world pretty much imploded for international travel, and it took us 6 attempts to get home. We were home in December 2020.
And it cost you a lot of money as well.
Yeah, that's right. Obviously, the cost of flights and also setting up another life overseas for 10 months was quite draining on our funds.
Mm-hmm. So I guess, I mean, we sort of think of our unalienable right to come home, but it's proving that's not the way the federal government sees it right now. You're taking this further. Tell us what your organisation's doing.
Well, unfortunately, it's times like this where citizenship is really tested, and the value of your citizenship, is put to the task. And unfortunately, like the World Health Organization, their advice all along, including with these new variants, is that essential travel should be, including repatriation, should be facilitated by countries. And unfortunately, Australia, to my knowledge, is the only country worldwide that is making it very difficult for its citizens to return home. So we set up a website, strandedaussies.com, just for it just has a lot of very simple tools for people who are stranded overseas that are in desperate times to actually advocate for themselves, put their story out there in the media and increase a bit of awareness and get some pressure on our governments, both state and federal, to work together to come up with a solution and a robust quarantine system that will facilitate citizens and permanent residents returning.
Mm-hmm. So, and I know that some people have been making submissions as part of an application to the UN Human Rights Committee about this issue. Here's Professor Kim Rubenstein, who's a professor of law at Canberra University, talking about exactly that.
This blanket ban that prevents Australians from leaving at the moment without a permit is arguably unlawful. But I think part of the reason why no one's gone to court to challenge that is because there is also the fear that even if they got permission to leave, they are going to be restricted from coming back in because of these caps on returning visitors. Now, so that's one part of the equation. The other is the Air Navigation Act controls the airlines in terms of their free movement and government regulation. And within that, what has happened is that the government has put through that regulations on the numbers of people who can come in on any flight. And that is what the airlines are responding to. Plus, anyone who's not a citizen needs to get a permit to come in. And so here is where the unfairness is even more emphasised, that the government is determining that some people are able to get those permits and travel in on a visa for a limited period of time if they follow those quarantine restrictions. So there are these different principles that are applying, and I think the electorate need to be more vocal about saying that this isn't good enough for Australian citizens to be essentially put behind those other individuals who are getting permits at the moment.
Yeah, that's Professor Kim Rubenstein from Canberra University talking on Friday to Josh Zepps about this. So, I wonder then, Kate Jeffries, if you have a view of how this should be organised, is the idea that is used in New Zealand one that you would back? And that's where there's like a queue, where you actually have to apply for a visa to get back into the country or for permission to, and you're placed in a queue.
Absolutely. I'd advocate for both the New Zealand system and also Taiwan. New Zealand in September 2020 at that stage increased their intake of citizens and PRs returning just to assist with families reuniting. And in September 2020, they were taking 3,500 per week. At that same time, Australia was taking 5,000 per week, and Australia actually has 5 times the population of New Zealand. So if you can compare both systems, I mean, New Zealand and just Queensland alone relatively have about the same population, 5 million each. And between April 2020 and January 2021, New Zealand took in 103,000 arrivals, whereas Queensland's taken in 39,000. And I think, we're constantly hearing the sentiment of we don't want to end up like America or we don't want to end up like the UK. But really what we should be looking to is world-leading examples that are proving that repatriation is both safe, possible, and it can be done humanely. And places like Taiwan, who are similar to Australia, it's an island nation, similar population, 23,000, people, they acted very early on because of their experience with SARS. And I think from April 2020, they were supervising 55,000 people home quarantining with technology assisting. And by October 2020, they'd managed to home quarantine 360,000 people with a 99.7% compliance rate. And their system is that robust that they're actually also now able to allow international students, migrant workers, and relatives of their residents to come in. And to date, they've had 1,090 cases. I had a look last night, and only 11 deaths. And in 2020, they were one of the few economies worldwide to actually grow. So there are examples out there of very robust systems that could be implemented in Australia. We could take learnings for them. We just need our government to actually have the political will to put these things in place. And I think the cost of that would be balanced out by not going into lockdowns all the time. The cost of the economy, the cost of loss of produce because seasonal workers cannot be brought in, the loss of revenue from international students, all of that should be taken into account to set up a robust system. And most importantly, it would enable citizens and PRs who've put so much into their communities in Australia and paid taxes and worked, they'd actually be allowed to return home, and citizenship would actually mean something in times like this where it's so important.
Kate Jeffries is with us, co-founder of Stranded Aussies Action Network. I wonder what you think about this, 1300 222 702. In a moment, we'll talk to Dr Andrew Miller, who is the president of the Australian Medical Association's West Australian branch, and see what he thinks. But I'll just read you some of the messages that have been coming in as we've been talking to Kate. Someone here says, re-quarantine, the feds must bring home more stranded Aussies. Some have been waiting 14 months. At this rate, it could be years before they return. Also, when travel bubbles open, won't tourism need hotels for the tourists? Dedicated quarantine centres must be opened now. On the other side of things, Diane says, Cassie, we can't go both ways. Can't congratulate ourselves for being so free of the pandemic while complaining about the harshness of our border regulations. Well, maybe there is a third way. I wonder if there is. 1300 222 702. Jim says, I believe that all citizens who want to come home should be empowered to do so quickly. And I cannot understand why people are stuck here and wanting to leave permanently and being prevented from doing so. Yeah, that does seem to be quite hard to understand. Graham says anyone coming back to Australia have to be vaccinated before being allowed to come back, and then they should still be put into a mandatory 2 weeks quarantine after having COVID tests every second day, then showing a negative test before being allowed to leave. Well, let's hear what Andrew Miller thinks. He's the president of the AMA in WA, which, as we know, is in lockdown. Good morning, Dr. Miller.
Good morning to you.
Now, can we just talk about what has happened there which has led to this lockdown, in case people aren't across the details?
Well, we have had a returning traveller who was put into our substandard quarantine and infected with the virus that was circulating in the air in that facility, and then went out into the community, of course, because they didn't test positive at that point, and have managed to unfortunately infect a few people in the community through no fault of their own. This is despite the government having been warned for a year now that this virus is airborne, but unfortunately there's a group of medical advisors to government who don't agree with that view, and so we're now in the bizarre situation of putting people who've managed to avoid COVID overseas into these hotels where they're catching it and then spreading it in our community. And so
yes.
We need to radically change things.
That Welsh nurse who's pregnant and with a 4-year-old toddler who managed to avoid it in her country now succumbs to it and catches it here in quarantine in Australia. It's a really bizarre situation. But you're a disgrace, you say, that part.
Yes.
Yeah,
it is, because it was entirely preventable, and she should be compensated, as should the community, for this lockdown.
And I hear in what you just said, sympathy for that person who did go to a wedding, was allowed to leave to go to an important wedding in India, and has come back with COVID-19. You feel that we should have sympathy for for that person's right to go and do that?
Well, of course, we need to have a think about who travels overseas and for what, and we should get our stranded Australians back before we do anything else. And I don't have any problem with having a list and a priority and vaccinating all of those people and looking after them as we should, because we've betrayed them and abandoned them in a disgraceful display from our government. But this person who travelled for a wedding did so in good faith, made all the right applications, was told they could go by the government, and then they were put into a negligent quarantine system. So we can't blame them for the negligence of the quarantine system that they entered into quite lawfully. That system is inhumane in that it incarcerates people in a facility where airborne spread is encouraged by the conditions within it and not mitigated. They're not giving people N95 masks in there. There's no attempt to have negative pressure in the rooms in there. They're not even moving the people away from COVID positive rooms so that when someone's COVID positive, they don't move those who are uninfected away from that floor. They're still holding school balls and high teas in the same facility, sharing the same air spaces and lifts. So this denial of airborne spread by the federal group of experts initially adopted in Western Australia, now rejected in Victoria, is the source of not only all of these problems, but of course the infamous healthcare worker infections in Victoria last year, the aged care deaths and so on. And unless we pull this system out by the roots and say we're not listening to any expert who denies airborne spread, then we're going to keep repeating this fiasco.
Right. Now, I heard you earlier point to a disagreement in the medical fraternity about this amongst authorities. Can you tell us more about what you mean there?
Well, there's no longer any disagreement amongst reputable scientists that COVID is transmitted primarily by the airborne route in indoor situations. So certainly you could catch it by touching someone or by them sneezing in your face, but most of the time you catch it in the same way as you breathe in cigarette smoke, and even when you're at close quarters where obviously you'll get a higher viral load. And what this has led to is a dumbing down of the PPE requirements and this fantasy that if you're more than 1.5 metres away from a person, you don't need PPE because you can't possibly catch it through the air. That's the essence of the argument. Now, that argument's been discredited internationally by scientists, but it's still held on to by certain advisors because to back down from it means having to accept responsibility for a lot of the problems that have occurred up until now, and probably a loss of face and their position as in the limelight as a government advisor. But governments need to be brutal about this because people's lives are at stake and government's success in controlling COVID is at stake. Our hotels have not been successful. About 1 in 200 COVID positive cases have broken out into the community. And then they start looking on the CCTV to try and implicate somebody in some breach when in fact it's just been travelling through the air the whole time.
Mm-hmm. Dr. Andrew Miller from the WA AMA is with us. Just stay there for a second because Sean has an interesting question/comment. Good morning to you, Sean.
Good morning.
Now,
look, I have a
go ahead.
Yeah, I have a question about the why they don't use the former Curtin Air Force Base and the Woomera facility. They had immigration detainees, 2,000, 3,000, 4,000 people at both of those facilities. There's an airstrip alongside. They can land an A380 aircraft there. I understand that it's a remote location, so there would be issues with people that had health problems, but I'm sure you could transfer people in and out. And it's not 5-star, but I'm sure a lot of people would be happy for 2-star just to get home.
Yeah, I think that's right. Look, thank you for that, Sean. Let's hear what Andrew says. There have been a range of proposals tried, and we know that Howard Springs is up and running and may well be expanded. There was a brief experiment with Christmas Island, and I don't really understand, why that hasn't been continued. What about these alternative facilities? Is this something that you think would work, Andrew Miller?
Well, down the track we do have to get to air-gapped facilities where people have private bathrooms, and I don't care which government sorts it out. They're both equally responsible for the mess that we're in. They have a national cabinet now, and as I understand it, they made some arrangements that everybody accepted at the start, and now that it's going badly, nobody wants to accept responsibility, but they're both responsible. And if there are good facilities at Curtin, then that would be great. but we could also throw up a mining camp very quickly, somewhere very close to Perth and be close to the airport and the metro hospitals. And because we certainly can't look after critically ill people out in the middle of nowhere. So, but those sort of accommodations can be put up in several months. The mining people tell me that's what they do all the time in Western Australia. It just takes the will to do it and the understanding that the current set of advisors need to go from the WA Health Department, because this is the second time already this year that they've ignored all warnings, ignored inputs from occupational health people, ignored inputs from engineers on air conditioning and so on, and carried on with this fantasy that if you're 1.5 metres away then you're safe. And so I don't care who solves it, but we're paying them all a lot of money to continue governing us,
Yep.
and they could get on and get it sorted out as soon as possible.
But, I mean, I know I don't want to draw you into the politics of it, but we just saw Mark McGowan being returned with a record majority in the recent WA election, and part of that is because he has been sort of tough on borders. Is there, no political capital in doing anything other than being extremely tough? I mean, why is there a hesitancy, do you think, to try other things if this is now looking like it's going to be the new normal for a while?
Well, I think it's more simple than that. I think this is just bureaucratic bungling and certain experts trying to hold on to their position at the ear of power. I'm sure that Mark McGowan is got the best interests of people at heart, and that if he thinks that this would be a better way of keeping the state safe, he would go for it. I'm not interested in the political arguments as to who's responsible for it, but these kind of distracting arguments that get thrown up eventually will wear thin with people, because whilst people will tolerate a few lockdowns, if this just becomes a repeat of the same old story, then politicians who have been incredibly popular in the past ended up not as popular over time. These things always fade. So I'm sure he has one eye on trying to blame the Commonwealth for this particular issue at the moment, because we made it very clear during the last lockdown, if they didn't change their quarantine arrangements, there'd be another one rolling around very soon. So I think this is squarely on the WA Health Department, and because their hotel quarantine is not nearly as good as Victoria's, that's for sure.
Well, how do you rate New South Wales? Because someone on our text line says, can you ask the doctor why New South Wales seems to be able to run hotel quarantine successfully, but WA can't? Is that negative pressure stuff that you're talking about?
Well, I don't think New South Wales does run it better. I think their rate of leakage is similar to ours, and I seem to recall quite recently there was an infection going on in your hotel quarantine, and they're running the same PPE standard in many ways as Western Australia. There's probably some aspects that they do better in terms of keeping all their COVID patients in one place. But the idea that you can do this successfully in buildings that are not fit for purpose, that weren't designed for this for the long haul, when you're getting increased rates of COVID in your returning travellers, is just a fantasy, I'm afraid. It might have worked pretty well when it was a low rate of COVID coming back, but when it gets to higher rates, as it will, only 15% of the world's population has been exposed to COVID so far. And the fact is, we do need international travel for all sorts of different reasons, and we should be able to have it. As your previous stranded Aussies,
Kate Jeffries.
Kate Jeffries, yes, thank you. We do need to have international travel for all sorts of very good reasons. For all sorts of very good human and business and cultural reasons, we've got to have it. But that requires governments having a bit of imagination and moving beyond these emergency hotels, which were understandable and forgivable in March 2020. But by the end of last year, we knew full well this is an airborne disease, and we've got obstinate federal and some state experts saying, no, that can't happen, it's surgical mask is fine. A surgical mask is not fine. If you hear anybody saying you can be anywhere in the same airspace as a COVID patient, even if you're metres and metres away, if you're not wearing an N95 and goggles and a suit, you're just not protected.
Yeah, look, it is, it's something that we've learned to live with. I'm going to ask you that really tricky question. How long do you think we might have restrictions on our borders? Can you see any point in the near future where they may well be lifted to the degree we have a sense of freedom about this?
I don't think that's a tricky question at all. I think with 85% of the world's population as yet uninfected and certainly not vaccinated for a number of years to come, and with variants of this disease arising all the time that may well evade vaccine, we're looking at years of this before it normalises, and there will be no normal tourism without quarantine for years, because the harsh reality of this particular disease is that most people don't spread it to anyone, but some people will spread it to a lot. And they're unpredictable, they're asymptomatic, and they're worst indoors. And so it's not going to go away anytime soon. We will develop better technologies and things, but border control and quarantine is something we need to invest in order to maintain our current freedoms and the ability to look outward and help others, certainly help our own citizens overseas. But we should be in a position now focusing on helping places like India and Brazil as well.
Hard to hear, but the truth is there. The truth is hard to accept. Andrew Miller, thank you very much for talking with us this morning.
Really nice to talk to you too. Thank you.
Dr. Andrew Miller, the West Australian President of the Australian Medical Association. And I guess, that assessment is kind of difficult for people wanting to leave as much as it is for those wanting to come home. Just finally back to you, Kate Jeffries. There's now discussion about restricting the numbers of people who can return from India because of the big outbreak that's on there at the moment. What do you think about sort of targeting particular countries and places? Is that fair? Do you think that's the way to go?
I definitely think as part of a solution and a robust quarantine system, arrivals from different countries should be risk assessed. I think it would be, arrivals from low-risk countries, I think they should be able to have the option of technology-assisted home quarantine, whereas arrivals from high-risk countries probably will need to go into hopefully a federally funded purpose-built facility. I think we just need an overhaul of the whole system. It's clearly not working, and I think I had a look at the ABS data from July to December last year for the number of citizens and PRs that actually came home to Australia. The same number were exempted to leave. So by the government's own admission, it is a cup that keeps filling and the system is not working. And the whole thing just needs an overhaul, and it just needs some political will to have a look at it and take learnings from other countries and apply them here and hopefully bring more of our citizens home. And yes, definitely risk assess where they're coming from and actually quarantine them appropriately. I don't think any stranded Australians overseas have any issue with going into appropriate quarantine. They don't want to get COVID. They don't want to bring it back to Australia. They don't want to bring it to their family, friends, their communities. We just need an overhaul of the system and a bit of collaboration at both federal and state government levels to come up with a solution.
Well, just before we leave, you say that cup does keep filling up. What is your estimate? What's your organisation's estimate of how many Australians are stuck overseas? There's 40,000 registered officially with the Department of Foreign Affairs and Trade, and 5,000 of those listed as vulnerable. How many do you think there are?
It's very hard to say. As you pointed out, those are only the people who are actually registered. The airlines have stated it closer to 100,000. So it's very hard to put a figure on it. But, over a year into this pandemic, that it's just totally unacceptable to still have 40,000 on the list and to have 5,000 of them vulnerable. At any one time prior to this pandemic, 1 million people were travelling overseas for a variety of reasons, and most people came back when they could. But if there is no flights to get you home, or you were already in lockdown and couldn't get to an airport to come home, and I think one key thing that's never really been made public is the advice for people who were, I know of a doctor who was in the UK doing her final year of study to come back to Australia as an optometrist. And the advice for people like that were out of the country temporarily working and had a safe place and a home was to sit tight. That was the advice on the Smart Traveller website, was people who were working overseas and had a roof over their head were told to sit tight and wait for a couple of months and see how this pandemic would play out, and that these kind of restrictions would never apply to Australian citizens and permanent residents trying to return. And it's turned out to be the exact opposite, and people are still stuck overseas, 13 months old, and it's just unacceptable.
Okay, Jeffries, thank you so much for taking the time. And I know this is a cause that you're just doing. You're home now after your long battle to get here, and you're doing this on behalf of those people. So thank you also for that.
Thanks so much for having me.
Kate Jeffries, co-founder of Stranded Aussies Action Network, based in Perth, and before her, Andrew Miller, also from Perth, both of them in lockdown because of this, which it's now affecting us all, isn't it? President of the AM8. I'm going to read you some of the extraordinarily different opinions that have been coming in on our text line in a moment.